digestive juices produced. Basically, everything goes to pot with age. Tonight, nutrition, metabolism, and body temperature regulation. A nutrient is a substance in food used by the body to promote growth, maintenance, and repair. There were major nutrients and minor nutrients. The major nutrients, carbohydrates, lipids, and proteins. Did I say that right? The major nutrients, carbohydrates, lipids, and proteins. The minor nutrients, vitamins, minerals, and water. Most molecules can be interconverted between molecule type. There are 40 to 50 that cannot be interconverted. We call these essential nutrients, and they have to be ingested as a molecule. Carbohydrates, the major fuel for ATP. Cholesterol, fallen from grace of late, but we need cholesterol. Proteins, we get from eggs, milk, and meat. The ones we get from legumes, nuts, and cereals are missing one of their amino acids. The ones that we get from eggs, milk, and meats have all of them. They are complete proteins. Vitamins, organic compounds needed in small amounts. The fat-soluble ones, A, D, E, and K. A, green and yellow vegetables. D, produced when the precursor is exposed to UV light in our skin. D is important in calcium metabolism. E, vegetable oils, whole grains, leafy green vegetables. E is an antioxidant. K, synthesized by the bacteria in the large intestine, essential for formation of the liver proteins. C and B are water soluble. C we find in citrus fruits, cantaloupes, and tomatoes. They are an antioxidant. Deficits can lead to joint pain, poor tooth formation and bone growth, poor wound healing, and increased susceptibility to infections. B, meats, liver, and whole grains. The minerals, there are 7 required: calcium, phosphorus, potassium, sulfur, sodium chloride, and magnesium. There are dozens of other ones that we take in trace amounts. Vegetables, legumes, milk, and some meats are the best sources for minerals. Our catabolic state of our body, our absorptive and our post-absorptive state. The absorptive state is the time that we eat and about 4 hours afterwards. The fasting or post-absorptive state is the time when our GI tract is empty. During the absorptive state, anabolism exceeds catabolism and glucose gets broken down for ATP production. The carbohydrates are broken down to glucose and other monosaccharides and taken out to be for the formation of ATP. The amino acids are absorbed after they have been delivered to the liver. Some of them are deaminated and become keto acids. We control all of that with hormones. Insulin directs the events of the absorptive state. Insulin. Its antagonist was glucagon. Insulin sends the glucose into the cell. Glucagon blocks that insulin from getting into the cell. So insulin is our hypoglycemic hormone. Glucagon is our hyperglycemic hormone. During the post-absorptive state, all of the activities are directing at maintaining blood glucose. We need 80 to 100 levels of blood glucose. There were some sources of glucose. Glycogenolysis in the liver was the main one. We had a glucose-sparing effect that allowed us to save our glucose in our blood for our brain if we need to. The liver role in metabolism. The liver is involved in protein metabolism, glucose metabolism, and lipid metabolism. And remember, the biggest and most important function we talked about with our hepatocytes was it detoxifies substances. It cleans out things that we put in our body. We talked about cholesterol metabolism. Cholesterol required for bile salts, steroid hormones, vitamin D. It's a major component of our cell membranes. We take in somewhere around 15 to 20% of our cholesterol dietarily. We manufacture 80 to 85% of it in our liver. We looked at the type of lipoproteins, the VLDL, the very low lipoprotein. He's a taxicab. He takes that protein out to, he takes that cholesterol out to the tissues. He does not stick it on the arterial wall. The LDL, on the other hand, takes that cholesterol out, and if he can't get it into the cell, he sticks it on the arterial wall. The HDL goes out and picks up that cholesterol, including that off the arterial wall, and brings it back to the liver to be processed. High cholesterols above 200 is associated with atherosclerosis, but we had to look at that ratio, LDL to HDL. LDLs above 160, bad. HDLs above 60, good. So we want more HDLs. We talked about body shapes and cholesterol. Men they call apples, where they have higher levels of cholesterol, and women they call pears, and women have lower levels of cholesterol. We talked about body energy and balance, our energy intake versus our energy output. The hypothalamus and the brain stem regulate our hunger and our satiety. The signal was based on neural signals from the GI tract, bloodborne signals from our body energy stores, hormones, body temperature, and some psychological factors. All of those things regulate our energy stores. Metabolic rate, basal metabolic rate, BMR, has some standard conditions: fasting 12 hours, reclining, relaxed, comfortable room temperature, the metabolism necessary to maintain life while that person is awake. BMR affected by or influenced by surface area, age, gender, stress, and hormones. TMR, total metabolic rate, the total calories consumed for all of our activities. A big part of TMR is BMR. Regulation of our body temperatures, normal body temp, 96 to 100. There were some mechanisms of heat exchange: radiation, conduction, convection, and evaporation. The hypothalamus contains our heat loss and heat promoting centers, the thermoregulatory centers. They receive input from thermoreceptors on the shell and in the core. There were heat promoting mechanisms and heat loss mechanisms that we used. And they were basic systems, or basic processes that we use to regulate heat production or loss. What happens with our nutrition and age? Everything goes to pot. The diuretics that we use for congestive heart failure, the antibiotics, the mineral oil that we intake, and alcohol depletes our calorie stores. Okay, everybody good with that? We'll do our test next week, and then we will do our urinary system after that. "20 minutes early." Did everybody sign the sheet?